I'm Jeff Allen, the Director of Sports Medicine and the Head Athletic Trainer at the University of Alabama. The University of Alabama has a tradition of excellence in football, and that was seen this year with our 14th National Championship. And our athletes, our coaches, and the entire staff in the athletic department work hard every single day to continue that tradition. Unfortunately, sometimes hard work can cause injury, and one injury that we see in particular in football that's caused by overuse a lot of times is a sports hernia. Today, with me to talk about sports hernias is Dr. Lyle Kane of the Andrews Sports Medicine and Orthopaedic Center in Birmingham, Alabama. Dr. Kane is a sports medicine fellowship-trained orthopedic surgeon. He's also an alumnus of the University of Alabama and the team orthopedic surgeon for all of our athletic teams.
My name is Dr. Lyle Kane. I'm one of the orthopedic surgeons at Andrews Sports Medicine and Orthopedic Center in Birmingham. I'm very proud to be part of the university's tradition and this current medical staff. I've had the chance over the years to treat a lot of different athletes at different levels, including recreational, college, and professional. And when working with these athletes, they oftentimes have injuries that we have to treat in the office or in the training room. One of the injuries that's probably least understood is called a sports hernia. A sports hernia is actually a weakness or an injury of the abdominal wall where it attaches to the pelvis. It is not a traditional hernia. It's not the traditional bulge and the pocket of fluid and swelling that you get in the older population. A sports hernia is usually caused by twisting rotational sports, very common actually in soccer and ice hockey, but we also see it in football, even at the University of Alabama with these preventative strategies. A sports hernia often causes pain doing things like sitting up or doing a coughing or sneezing episode. Sometimes it prevents the athlete from being able to cut or twist or rotate their pelvis because they have pain. And in some cases it actually requires surgery to repair this. One of the big pushes at the University of Alabama is always on preventative treatment. And Jeff Allen and the training staff do a great job with the strength and conditioning coaches on working the core and the abdominal muscles and trying to get core stability, which I think helps prevent these injuries. If a sports hernia presents itself and it keeps the athlete from playing, there is a surgery that the physicians at Andrews Sports Medicine and Orthopedic Center may have to perform to get the athlete back on the field. The surgical procedure actually involves repairing or reattaching these pelvic and abdominal muscles back to the pelvis. So instead of the traditional hernia surgery where a piece of mesh is applied to close up a hole, in sports hernia surgery, the muscles are actually reattached back to the pelvic bone to relieve pain, give the athlete better function, and hopefully get him back on the field. With any injury we have, it's very important for the healthcare team, the physicians and surgeons, the athletic trainers and the physical therapists to be on the same page and to communicate. And we've got a great team here at the University of Alabama. We're very, very proud to be a part of that team.
Thank you, Dr. Kane. Sports hernias are really a frustrating injury for athletes, for coaches, for athletic trainers, for everybody, because you have an athlete, and correct me if I'm wrong, a lot of times they can play, but they end up having this chronic groin pain that just nags them, for lack of a better term. Is that right?
There's no question. And I think in the past, sports hernias were very misunderstood, and even today I think they're misunderstood in a lot of circles. The problem is they've been diagnosed as a groin strain or abdominal strain, but they linger on. They go for a long time. So my thought process is any injury in an athlete that's going to heal itself usually heals over a period of 4 to 6 weeks. And once you get past that point, you have to think that maybe there's some problem that needs to be addressed. And that's where we get into diagnostics like MRI scans and different tests to diagnose a sports hernia. But sports hernias are very difficult to diagnose even by MRI scan. And so I think it's one of those things that experience and having people that have dealt with it are very important. And that's why we're so happy to be involved with the university because we have specialists in all the different fields that can treat these injuries.
These injuries are just really, really frustrating, and it's an injury, quite frankly, that as an athletic trainer, it's difficult to deal with because the symptoms can be real vague, but you have an athlete that just has this chronic pain, chronic groin pain, pain in their abdominal area and their abdominal muscles, and they just can't function. That's why this is an injury that's for sure makes me thankful that we have an association with the Andrews Sports Medicine and Orthopedic Center, and in particular with Dr. Kane, because these are injuries that a lot of times a lot of physicians are going to miss, not know how to treat properly, and I know for a fact and from experience here that when we have guys that have had sports hernias, they're in great hands with the Andrews Sports Medicine Center. So thank you, Dr. Kane.
Thank you, Jeff. We at Andrews Sports Medicine are very proud to be part of the University of Alabama tradition and current medical staff. Our commitment every day is to try to treat athletes, the best that can possibly be treated, to give them prevention education and rehab to get them back on the field. We're very excited to be part of the university, and if you have any questions about any of these athletic injuries, including sports hernia, please visit our website at www.andrewscenters.com or call us at 205-939-3699.